Cardiovascular disease is the #1 killer in the United States. The #1 cause of cardiovascular disease is atherosclerosis. Atherosclerosis is the abnormal depositing of cholesterol within your arterial walls. Familial hypercholesteremia is a genetic defect that causes severely elevated cholesterol in your blood. Therefore, patients with this problem have a higher propensity of cardiovascular disease and also a higher risk prematurely of developing cardiovascular disease. Roughly 1 in 500 people are at risk of having FH. This can go down to 1 in 50 in certain populations. This is actually the most common genetic defect existing in the United States presently at this time. As is true with most chronic diseases, early diagnosis and early therapy can have an immense effect on prevention of events, in this case cardiovascular disease for FH patients. Therefore, it's imperative that patients and parents of patients have their members of their family be diagnosed early by their healthcare provider, or ideally with an expert such as a lipidologist who's trained in the field of FH. The National Lipid Association this past year brought together a group of experts in the field of FH. As one of the co-authors of this group, we put together a white paper analyzing the diagnosing and a treatment necessary for FH population, both in the adult and the pediatric population. For children of FH patients, diagnosis should be performed as soon as possible. Once the diagnosis is made, then an expert, such as a lipidologist, should then decide when to initiate aggressive medical management if needed. The NLA has put together a program called FH, Its Relative, for the general population. Its goal is to expand the awareness of the disease of FH, and by doing so, expand the therapy needed for these patients in order to prevent them from developing early cardiovascular disease. For further information regarding FH, you may go to the website learnyourlipids.com. This site will present to you information related to the genetics of FH, the diagnosing of FH, and the treatment. Additionally, there will be sites of specialists, lipidologists in the field you can find in your area of the country in order to see for further reference and awareness.